Would you mind just explaining about the importance of vitamin C on the body?
Well, vitamin C is the primary antioxidant in your body. There are many, many things that are other and have antioxidant ability. The significance of having a lot of antioxidant, like vitamin C in your body, but other antioxidants as well, is that they give electrons back to oxidized biomolecules. Oxidize means an electron was taken away. And you take an electron away from a biomolecule, you inactivate. So really all disease is how many biomolecules have been inactivated by oxidation, where are they located, where are they concentrated. That's what determines what disease you have. And what oxidizes biomolecules are toxins, nothing else, toxins. That's it. That's the end of the story. Toxins damage you and biomolecules by oxidation. So vitamin C can come in and restore the damage, not restore the damage, restore the health of the cell by reducing the biomolecule, giving you the electron back. And of course, at the same time, and this is where all the dental stuff comes in, you need to stop the new toxins from coming in. As Dr. Huggins told me many times, he said, Tom, you can't dry off while you're still in the shower. Okay, so it's not enough just to repair the old damage. Obviously, or it should be obvious, you need to prevent the new damage that's occurring on a daily basis, which almost always comes from the mouth. So when I first wrote the book, Vitamin C, Infectious Diseases and Toxins, Curing the Incurable, I thought about this long and hard because it was very clear empirically in the literature, in my clinical experience, and Dr. Huggins' experience, and other clinicians that I talked to and interacted with, that high-dose intravenous vitamin C would absolutely pull you out acutely of any poisoning or toxic situation. Didn't matter what the toxin was, didn't matter what the poison was. And I said, how on earth can one simple molecule neutralize the toxicity of thousands or hundreds of thousands of other molecules, all different in size, shape, and manner, with all different toxic presentations, toxic clinical syndromes, but it did it. So I said, the only logical explanation is that vitamin C is reversing the final common denominator of what makes a toxin toxic, and that is oxidation of biomolecules. And this is why vitamin C universally is good for any condition. It's not going to cure the condition if you haven't taken care of the toxin source. But if you have taken care of the toxin source, many times vitamin C can completely resolve these conditions, because when you stop damaging the tissue chronically and long-term, and then bring in antioxidation to bring the biomolecules back to their normal state, you have health. And of course, this is supported in the literature directly and indirectly by probably some 80,000 articles on vitamin C. That's another thing too. I told you about the medical textbooks. There you have 80,000 articles on vitamin C and everything it does in esteemed research laboratories around the world, esteemed medical institutions, but it's not in the medical textbook. I mean,
Why?
my
Why is
humble
that?
opinion these days, especially after the pandemic, if anybody has their eyes open, is modern medicine not only does little good, little of the time, it does a lot of harm. It does a lot of harm because not only does it promote toxic pharmaceuticals at the same time, and I can't tell you how many emails I've had over the years on this, it actively suppresses and ridicules things like vitamin C that could take people out of septic shock, which kills most people when they're in the hospital, for example.